Hey guys, Dr. Cliff here with HearingLoss.com, and in this video, I'm talking about what makes a prescription hearing aid. As of October 2022, we have had two different categories of hearing aids: over-the-counter hearing aids and prescription hearing aids. Now, if you'd like to learn more about over-the-counter hearing aids, feel free to check out our other video that I will link in the description right after you watch this video on prescription devices. Prescription hearing aids are intended for individuals with nearly every configuration and severity of hearing loss, ranging from mild to profound, and are the best and only treatment option for over 90% of hearing losses. They require a professional fitting by a licensed provider who has been trained on how to test your hearing and select, program, and provide ongoing service for your prescription hearing aids. The purpose of prescription hearing aids is to restore audibility of sound that is lost due to a hearing loss. Basically, they're used to amplify sound so you can hear those sounds again. Of course, this is an extreme oversimplification of what a prescription hearing aid is capable of. Unlike turning up the volume on the TV that increases the low, mid, and high frequencies altogether, a prescription hearing aid is capable of increasing very specific frequency ranges based on the unique characteristics of your hearing loss. For instance, if you only have a hearing loss in the high frequencies, like most individuals do, then a prescription hearing aid can be specifically programmed to increase the amplification of sound in these high frequency ranges without amplifying sounds in the low, mid, and high frequencies that you do not have a hearing loss in. To ensure that the programming of your prescription hearing aids has been done correctly, the amplification levels should be verified using real ear measurement. Now, if this is the first time that you're hearing me talk about real ear measurement, make sure that you check out our other video that I will also link in the description. Ideally, the amount of amplification you receive from your prescription hearing aids should match your hearing loss prescriptive targets to ensure optimal audibility, auditory comfort, and speech intelligibility. However, beyond ensuring that you are meeting your audibility targets with real ear measurement, prescription hearing aids are also loaded with a bunch of different features to optimize your hearing performance in a variety of different situations. This can include quiet situations, background noise, watching TV, talking on the telephone, understanding soft talkers, and the list goes on. There are a number of different prescription hearing aid manufacturers, but the best ones are typically developed by the major hearing aid brands that include Resound, Starkey, Phonak, Oticon, Signia, and Widex. Which brand is best for you depends on what your specific wants and needs are and how good your hearing care professional is at fitting and programming your devices. Prescription hearing aids also come in a variety of different styles and technology levels. For instance, you can get a prescription hearing aid in an invisible in the canal style, half shell or full shell in the ear style, a receiver in canal style, or a behind the ear style. After you select the most appropriate style with the help of your hearing care professional, you will then need to select the most appropriate technology level. Most prescription hearing aids will have anywhere between 3 and 5 different technology levels. The higher the level, the more features and customizations your hearing care professional will have access to customize the programming of your prescription devices. Of course, the higher the technology level, the more the devices will cost. Which level of technology is most appropriate for you is a conversation you should have with your hearing care professional. If you're like the majority of individuals with hearing loss, prescription hearing aids are your best option due to their overall level of customization when it comes to treating your hearing loss. And since you purchase them from a local hearing care professional, you will have ongoing local support if your hearing changes or if your hearing aids require repairs. So if you have difficulty hearing and are considering going the prescription hearing aid route, make sure that you schedule an appointment with a local hearing care professional to get your hearing evaluated and to discuss your prescription hearing aid treatment options. Alright guys, hopefully you enjoyed this video. If you did, make sure that you hit that like button and subscribe to the HearingLoss.com YouTube channel for more informational content, and I'll see you in the next video.